In this lesson, we're going to talk about placenta previa, what it means for the patient, and your role in the care. So where is the placenta supposed to be? Let's first talk about that. So the placenta is supposed to be in the fundus, at the top part of the uterus. In placenta previa, it is in the wrong place. It can be either complete, partial, or marginal. In a complete placenta previa, it completely covers the cervix. So complete is completely covered. Partial is that it partially covers. So partly covers. So it is just a small portion of the placenta that covers the cervix. And then in marginal, it is on the edge or on the margin of the cervix. You can see in this picture up here, this is the top part of the uterus, the fundus. That's where it's supposed to be. So this is correct. And then down here, here's our cervix, and you can see where that placenta is. This one looks to be kind of partial. You can notice that there's some bleeding that we'll talk about. All right, so our assessment, let's look at that. What is it going to look like? It is going to be painless bright red bleeding. We need to know how much bleeding is occurring. So we can ask the patient, how many pads have you changed? How much bleeding are you having? When was the last time there was bleeding? It's important to remember that this is always going to be painless bright red bleeding. So where we talk about the placental abruption, that one is very painful. So this patient might not be complaining much. There's no pain with this because it's painless bright red bleeding. In addition to asking how many pads, we can ask the consistency of it, like is there clumps of blood or there clots, that kind of thing. And then we also want to have assessed the placental location on ultrasound. So that's how we're going to confirm that it's placenta previa is on an ultrasound, will be our confirmation. So remember, we want it to be in the upper part of the uterus, and the fundus is where it should be. And then we want to know if it is a previa, is it completely covering the cervix? Which would be complete, or is it a marginal or partial placenta previa? Our management for this patient will involve a few things. So first of all, vaginal exams, these are going to be contraindicated. We don't want to have a hand in there irritating the cervix, causing more bleeding, right? Doesn't that make sense? So it's contraindicated. We're going to monitor the amount of bleeding, so how much blood loss she's having, and then vital signs to watch for if we're being affected by that blood loss. There are times that we have patients that are on the unit for even a week or more, and we're just watching that bleeding and assessing it. So these patients stay in bed, and pad counts are done and weighed for how much blood loss. When they check for the weight of the bleeding, they put it on a scale, and 1 gram equals 1 milliliter of blood loss. So if they weigh a pad that weighs 250 grams, that means that she has lost 250 mLs of blood. And then our delivery for this patient. So this patient is going to most likely have to deliver by C-section. If it is a complete or a partial, it has to be a C-section. Sometimes if it's marginal, they might attempt a vaginal delivery, but typically cesarean section is going to be our delivery option for this patient. Our education for this patient is going to involve having the patient report any bleeding that she has. She might need to come in for monitoring if she's having bleeding. And then the nurses, remember, will measure the bleeding to assess for loss. So remember that 1 gram equals 1 ml of blood loss. This is going to be how they quantify how much blood is actually lost. And then bed rest. So bed rest might be necessary for this patient to help slow or stop the bleeding from occurring. Our nursing concepts for a patient with placenta previa are going to be perfusion and safety. There is a concern of perfusion to the fetus because we're losing blood and we're losing it through the placenta. So we're concerned about that for the fetus. And then we're also worried about the safety of the mom and the baby with all that blood loss. Okay, what have we learned about placenta previa? So it is where the placenta is attached wrong. It's attached too low in the uterus. It is supposed to be at the top. There is painless bleeding. So we're going to monitor the amount, that 1-to-1 ratio. to quantify blood loss. We are going to be monitoring the blood loss as well as monitoring vital signs. And then delivery is going to most likely be by C-section. Remember, the patient's symptoms are going to be painless bleeding. That is your key here. If you don't remember anything else, remember it's in the wrong place. We have painless bleeding, and we are going to deliver by C-section. We are concerned about the safety here, and that is going to be the safest delivery option. Make sure you check out the resources attached to this lesson. Compare this placental previa with placental abruption, because these two can get a little bit confusing together. So just to be able to separate them out. Now go out and be your best selves today. And as always, happy nursing.